fact, the Health Ministry has recommended homemade face covers for public at large. This advisory comes on the back of India Today campaign on the need to use masks, which you can make yourself, do-it-yourself masks. The Health Ministry has also said that people who are not suffering from medical conditions or having breathing difficulties may use these homemade reusable face covers, particularly when they step out of their homes. While there has been a mad rush across the country for buying masks, the advisory now makes it quite clear that such face masks are not recommended for health workers or those working with or are in contact with a COVID-19 patient. And now, as we know, the debate is still on whether or not to wear a mask. Every single person, should those without symptoms wear a mask or not? The CDC in the US has now made a U-turn, claiming that masks are essential. This while the WHO claims that only healthcare professionals need to wear masks. So, what should you really do? India Today breaks it down for you.
A global scramble for masks. This despite the official advice from the WHO not to wear them if you aren't sick and aren't caring for coronavirus patients or suspects. America's Center for Disease Control and Prevention is now likely to change the official guidance. The CDC is considering recommending do-it-yourself cloth coverings. Many in India have now also begun to believe any mask is better protection than no mask at all.
We don't advise everybody to wear N95. N95, yes, especially we are taking a special precaution. People who are dealing with the patient, people in a critical care, people in the casualties, people at home. You can take a normal cotton cloth, put 4 strings over there, and ladies can use their dupattas. We take our hanky, put over there. They will at least we can protect others from something. When we are coughing, our droplets will not go that far off.
Officially, though, India is still guarded about facial protection. The government's thrust remains on social distancing. Social distancing is indispensable in the fight against COVID-19. For people, masks serve as an additional physical barrier against infection.
Experts say that you don't need a N99 or N95 mask to protect yourself from those who may have developed symptoms of COVID or those who may be coughing, because the size of the virus is bigger. Hence, a normal cotton cloth or a normal covering for the mouth would also do.
Daily mask wearing is a social etiquette standard in East Asia. Some say it's probably Japan's mask culture that's helped the country slow the spread of coronavirus despite having multiple hotspots. India has no culture of mask wearing. But as the pandemic worsened, ordinary Indians have embraced the protection on their own. With Milind Sharma, Bureau Report, India Today.
Now, India is under the biggest lockdown